Oh, I didn't even know they was still up there. Hey now, let's change this because that's not what we're doing today. Hello, hello, welcome. Okay, what are we talking about today? Oh, we're talking about male sexual dysfunction. All right. I guess I didn't click on that. I clicked on everything else. Hey now, hey now, hey, hi, hey. I know that you missed me. I know that you missed me so much. Right? I know that you missed me so much. I missed you too. I missed you so much I followed you today. I'm just playing. I'm just yeah. Alley cat coat wearing. No, I'm just I swear I'm sober. I swear that I am. I haven't even eaten today. Just running off the energy of life as usual. Um, well, welcome. It's Monday. I hope you had a great weekend. Um, I did. I got to clean up. I cleaned up everything in like one day. Now, mind you, my husband helped me. I did. I definitely didn't do it all by myself. But because he did help me, I was able to like get it all done in a day. And so I'm super excited about that. What else did I do? Gosh, I got tricked into a birthday dinner. If you one thing you need to know about me, I hate birthday dinners. I hate them. Don't invite me to your birthday. Me and you could go out. I will go spend my own money to take you out by yourself so that I don't have to go to a birthday dinner. But I did go to a birthday dinner and it was a brunch. And I had a good time. I did. I had a good time. I don't have nothing to complain about. It was fun. Let me turn this light on. I'm missing a light. So I did have a good time. I don't got nothing to complain about. It was good. What else did I do? Not too much, nothing else. Just working and working, and working and working. But yeah, it was a good weekend. It's supposed to be what fall is supposed to be falling in here. I hate fall is my least favorite season. I hate fall so much because I don't be knowing what to wear. It be cold in the morning and I be out there in the coat and then I be musty because I'm hot. I hate fall. I look like a little kid dressed me during fall. I do. I be out in flip flops and leg warmers. Ugh, I hate it so much. But we are here. I'm happy to be alive for another fall. I'm definitely happy about that. But like September is usually the beginning of my busy season. So like my busy season runs from like September to March. September to March. And man, it's already starting. It's already starting. It is. It is. But I'm grateful for that because I mean I get to do stuff. So I appreciate that. I'll take that every day. But yeah, I had a good relaxing weekend. I hope you did too. I hope you are ready for the fall. Get them crock pots out. I made me some little neck bones. They were amazing. It was a good time. It was a good time. Matter of fact, I think I got some like leftover. I made some Trader Joe's fried rice and I put some steak in there. It was good. I think I'm gonna eat that. And then I think I got some leftover chicken that my husband made this weekend, so I'm definitely gonna eat that too. And I didn't have to cook this weekend. I don't know. I probably have not been the best wife this weekend, but I've been tired too. So I'll be a better wife this weekend. Make up for it. If they had work, if I just like do 2 more things this week, then it'll run my wife meter back up. But yeah. Thank you for tuning in. I appreciate you being here. Okay, so let me give a little trigger warning because it's not a super trigger warning because we're not going to be talking about, not going to be showing any like pictures or anything like that, but we are specifically going to be talking about male sexual dysfunction today. So there are going to be a lot of words that could possibly get us in trouble. But I'm still going to use them because you need to know. So just a slight warning. The class today is on male sexual dysfunction. Male sexual dysfunction is actually a condition that is linked directly to your mental health. And so we're going to be talking about the 4 different types and, where you could be falling into, what the type of treatment options you have and like how to lower your risk and, and making sure that you are not indirectly affecting your mental health by ignoring your physical and sexual health. So we're going to be digging deep into male sexual dysfunction today. So, hang on. Hang on. But remember, all of this is to help you, is to make you better. If you are not experiencing sexual dysfunction, there is a high probability that you will in the future. If you keep living and keep having sex, you are going to experience some issues. And it's better to know how to address those issues before they come versus having to be retroactive and trying to figure it out later, right? So, I think my sugar muffins is here. He did say he was coming home on his lunch, but it's not lunchtime. I don't know if that's him though, because he wouldn't be. I hear music and he don't be listening to his music that loud. Anyway, but yeah, so we will be discussing male sexual dysfunction and just talking about how it comes about, what you can do to get ahead of it, what you can do if you're already experiencing it. And again, the male sexual dysfunction is one of those things that people think that it's supposed to happen to the body. This is, you know, an experience that you are supposed to deal with, and that is not true, right? Nothing that is causing you harm, that is causing harm to your physical health, that is causing harm to your mental health, is something that is necessary. It is my sugar muffins. So I didn't know he's coming. I'm excited. Okay, hold on. Hi, babies. Yes. So that's what we're gonna be talking about today. So let's get into it. I don't want to waste no time. You know, I don't want to be the reason that you don't make it. Okay. All right. So male sexual dysfunction. That's what we're going to be discussing today. Again, slight trigger warning, not a big one, but again, some of the words that we're going to be using, some of the language we're going to be using is usually filtered out and could cause issues. So if you are at work, please put your headphones on so that people don't put us out, because you know I can't pay your bills if you get fired, baby. I can't. You can't come live here, okay? So make sure you got your headphones on. But again, this is information that even if you are not experiencing any type of dysfunction right now, as you get older, there's going to be something, right? You're going to fall into something. So it's a good amount of knowledge to have for when it does eventually happen. Okay. So what are we going to be discussing today? Ooh, let me turn my captions on just in case you need to catch it. Objectives. After this stream today, you're going to be able to list the 4 main types of sexual disorders, and you're going to be able to outline the 3 treatment options for male sexual dysfunction. All right. So why is this information important? Why are we discussing it? You know, what is it? What are we doing it for? Well, male sexual dysfunction can be a primary or secondary disease. It's important to rule out any other underlying conditions or medications resulting in secondary sexual dysfunction. Underlying conditions include cardiovascular disease, peripheral artery disease, diabetes mellitus, psychological factors, testosterone deficiency, neurological disease, chronic kidney disease, hypertension, hyperlipidemia, endocrinopathies, thyroid disease, and obstructive sleep apnea. Okay. Medications that can result in sexual dysfunction are antidepressants, antihypertensives, antiandrogens, diuretics, opioids, sympathetic blockers, and anti-Parkinsonian medication. Okay? So why is this important? Sexual issues are considered a proven indicator of cardiovascular events. What does that mean? Cardiovascular is how your blood moves through your body, moves through your heart, and and feeds the body, right? If you are having issues with blood getting to your penis to make it erect, you are likely having issues with blood getting to other places as well. So erectile dysfunction is actually a known predictor of chronic heart disease, stroke, things like that. Okay. So if you are having issues where your blood is not getting to that area, it's likely not getting to other areas as well. And that could mean something bigger than just erectile dysfunction. Okay. So we're talking about a known indicator of a cardiovascular event. There is a strong link between sexual function and mental health. Again, how you see yourself, how you view your experience, your sexual experiences, how you show up in those spaces. If you don't feel that you can show up wholly in those spaces, you could have a lower quality of life. Okay. I'm trying to keep us up. All right. So if you are worried about getting an erection, and you know that there have been other times that you have not gotten an erection when you needed one, and you get in front of another person, you are going to automatically be anxious about if it's going to work this time, even if it's only sporadically. Is the blood going to get there this time? Am I going to be alienated for this experience? And so if you are experiencing those types of dysfunctions, it's going to have an effect on your mental health as well. It's going to cause you to be anxious. It could lead you into depression if it's something that continuously happens. So you're talking about something that's not just in the body, but that can affect the mental and your mind as well. Medications for other conditions could affect sexual health, okay? If you are taking mental health medications, that could have an effect on your sexual health. If you have diabetes, if you have hypertension, if you already have cardiovascular issues, though the medicines, the pharmacology for those issues could also have an indirect effect on your sexual health because they could impede your blood flow, it could impede your libido, it can impede a lot of processes that you use during sexual encounters. So, the medications that you have that are saving your life from something else could possibly be causing sexual issues in other parts of your life. So, medications are one of the first things that I ask when someone presents with different types of sexual dysfunctions. What kind of medicines are you taking? Are you taking medicines for BPD? Are you taking medicines for schizophrenia? Are you taking medicines for HIV? Are you taking any of these types of medications that could have an effect on your immune system, that can have an effect on the way the blood moves through your body, because your penis needs blood to become erect? And we'll talk a little bit about that after we go through this, like what is actually happening in the body, like where is that going, what's it doing? And then age has been suggested as a key risk factor for sexual dysfunction in men. So getting older, people are aware that getting older is, one of the byproducts of that is a reduced sexual quality. And so age has been a very good predictor of if someone is going to experience sexual dysfunction, just because, if you've been getting erections for 60 years, right? Because erections have been noted in utero. So if you've been using that muscle, that corpus cavernosum, for 60, 70 years, it's not going to be peak performance as it was when you were only using it for 10, 15, 20 years, or however many years you started. So there is an expectation that there is a lower quality of your experiences, but not that it should be completely shut down, right? But what tends to happen is that when people start experiencing sexual dysfunction, they get anxious about those dysfunctions appearing in front of other people. So you just cut it off, right? And that doesn't just go for men, that goes for women as well. If they're not creating the same type of lubrication that they were before, or if they are now experiencing pain during their interactions, instead of addressing the issue, they just think, oh, this is one of the things that's supposed to happen, and so I just need to stop, right? I shouldn't have sex. So it can make you turn your libido off, even if you don't necessarily want to. So even if you do still get aroused, the anxiety of the other stuff that could come with that blocks in your mind. It could block that out and just make the experience not even worth having, which is the reason why you just say, forget it. What's the reason, right? So that's hold on, let me go back. There are four main types or categories of sexual dysfunction. So we're going to go into each type, because just because you're, erectile dysfunction because the blood's not going there is not the only way that men experience or males experience sexual dysfunction. There are 4 different categories that if you were to talk to your physician, they're going to ask you questions and you're going to end up in one of these categories. So the first category is going to be desire disorders. So low sexual desire includes a lack of interest in thinking about sex or in being sexual, either alone or with a partner. This could be due to hormonal changes, medical conditions like diabetes and heart disease, relationship problems, sexual inhibitions, which we're going to put a star in that because we're going to tap on that. Fatigue, fear, depression, and anxiety can affect the desire to have sex. And so I think sexual inhibitions is one of the ones that people don't necessarily think about, but I believe that it has more of an effect on the way that people experience sexuality than we realize. And when I say sexual inhibitions, I always use the perfect example is the fact that Republican conventions usually crash Grindr, right? But Republicans are very much and very staunch. They, craft laws. They make it more difficult for people who are gay to, experience and have the same rights that they have. They want to sneak and live that life, but they don't want to help others who are out and living that life to be able to come out and live and enjoy a safe space just like the rest of us. And so that is not even just for, your sexuality. That's also in the things that you are that create arousal in you. And so if you don't feel like you can successfully indulge in those inhibitions, that is also going to have an effect on the desire. So say you're a person that likes to role play, okay? But you grew up in a, and I don't know this, I'm just throwing this out there, but you grew up in a Mormon religion. You grew up as a Mormon. And I don't know if Mormons can role play or not. I'm totally just making this up. But let's say they don't, okay? That's not something you can do, that we're just using sex to make babies and that's it, right? If that is something that you want or that you use as a part of your arousal process, but your religious beliefs don't allow you to engage in that type of activity, that means that you have to suppress that desire, which doesn't go away. It's gonna keep peeling and eating at the skin and eating at the body. And I believe this is not, there's no scientific evidence about this. I mean, it may be, but I believe that is what leads into deviancy. When you don't feel that you can safely engage in the desires that you want, people tend to go underground to do that. Now, some of the desires should not be engaged in, right? Some of those desires that you see underground are harmful. They're harmful to other people. And if it causes any harm to another person, then that is not a relationship that I will ever, ever, ever condone, right? And I condone pretty much, you can do whatever you want, but my two rules is that everyone has to be of age and everyone has to be having fun. Those are my two rules. If it does not meet those two requirements, then you are in an unhealthy exchange, an unhealthy relationship. Sorry, I didn't mean to trigger that. And, I am never speaking in those terms. I am never considering that everybody has to be of age and everybody has to be having fun. Those are the requirements for all the conversations that I have around sex education. So, but there are others that are totally within those two parameters that people still are struggling to break free of, whatever is the reason that they're not engaging in those behaviors. Sometimes it's societal pressures. Sometimes it's religious strategy. Sometimes it is, you're not having a support group. Sometimes it's fear. Sometimes it is, a self-preservation thing that I know that I can achieve more in life, or I can pass if I don't do that. If no one ever knows that I live this type of life, I can still enjoy the fruits of, these other labors without having to, out myself or, whatever the parameters are. But if you do that and you squelch that deep inside of your body, it doesn't go away. That is not the way energy works. And so desire is it can be turned off, but it is not turned off as easily as you think it is. It can grow and fester in the body. And it can manifest in other ways. It can make you angry. It can make you disagreeable. It can make you short with people. If if you don't feel like you can exist, and you don't feel like that you are seen, and that what you have going on is important, you will absolutely take that out on the people around you. That's not just your partner, that's your coworkers, that's your friends, that's your family. That is going to manifest outside of the body. So it's important that you come to terms with who you are, come to terms with the things that you like, so that you don't end up being one of those angry people who nobody wants to work with and everybody hates and you don't realize that that's what it's turning you into, but it can absolutely do that, right? And then other things, another big part of that is hormonal changes. As you get older, you have less access to your testosterone. You have less access to estrogen if you are not in a male body. But even female bodies need testosterone. You need both. You need estrogen and testosterone. The levels that you need change, of course, or how much you need. But if you are just having desire issues and you are in a female body, they will absolutely prescribe you testosterone to get that level back up. And so hormonal changes will have those effects on you, and it's not something that you have any control over. You have control over if you want to fix it, but you do not have control over how much you have in your body. And so that can have an effect on your sexual desire if your hormones are out of balance and you are not receiving the proper chemical reactions to get the desired effect. So it's a big thing. If you are becoming less interested in sex, it likely has an underlying issue that can be addressed and that you can actually do something about, that can be pinpointed and you can do something about. Another type of disorder is arousal disorders, which the two most common diseases that cause erectile dysfunction are atherosclerosis and diabetes. So erectile dysfunction is the consistent or reoccurrent inability to attain or maintain a penile erection sufficient for sexual satisfaction. When a person has arousal disorder, he or she may be interested in sexual activity, but be unable to get any physical satisfaction from it. Men with a healthy lifestyle and no chronic disease have the lowest risk of erectile dysfunction. So desire disorders are you not even wanting to or not even being interested in sexual activity. Whereas arousal disorders are you being interested in sexual activity, but the body is not reacting to that interest. You know? I see you in a little bit. Love you. So it's not necessarily the same thing. Arousal and desire disorders fall into different categories. And so if you still have a desire for sexual activity, but the body is not responding to that desire, that could cause all kinds of mental health issues. It can cause all kinds of physical issues as well. But to be able to lower the risk of their arousal disorders, of course, it's going to be eat better. Actual exercise increases the testosterone in the body. So lifting weights, getting physical, getting active, those types of things increase the amount of testosterone in the body if it is from a health standpoint, okay? Not a medicinal, not like this is not a secondary side effect of medicine, but if it's just you're experiencing, you're older, you're a little bit more out of shape than you were, getting back in shape and getting your body into a normal system of working out and lifting weights and doing all that can increase the amount of testosterone in the body, which can help with arousal disorder, or at least men with a healthy lifestyle and no chronic diseases, because you can still have a healthy lifestyle and be a diabetic and all those types of things. But if you don't have any chronic diseases, being able to maintain a healthy lifestyle can help with any type of arousal disorders that you may be experiencing. And so Something like atherosclerosis is going to be, narrowing of the veins. I believe that's what that means. Look, let me check, cuz I be mixing stuff up. I'll see what we talking about. Yeah, buildups of fats and cholesterol and other substances in or on the artery wall. So it's, your veins and your arteries that move blood throughout the body being clogged because of, a high fat diet or, all kinds of things. So it's important to keep those arteries clear. Here's a good little picture of it. What website is that going to take us to? Okay, Cleveland Clinic. I could take that. Okay, so this is a normal artery. This is an artery that has atherosclerosis, which is just a plaque buildup around that artery. And then, so what happens? This plaque buildup can also become loose and get to the heart. That could cause different issues, but you will see here that it forms, and then there's a growth, and then you'll see a rupture of that plaque, and then a blood clot forms around that. And if that blood clot moves through your system, you could experience a stroke or other type of cardiac event. So just getting healthier, making being active a part of your lifestyle, getting better at taking care of yourself can increase or lower the risk for erectile dysfunction in this category, in arousal disorders. Orgasm disorders. Premature ejaculation, also called PE, is defined as a persistent or reoccurrent pattern of ejaculation occurring during partnered sexual activity within approximately 1 minute following vaginal penetration or before the individual wishes it. So premature ejaculation is a disorder that does not just affect men. We don't have the conversation often about how it affects women, but as long as I've been in this field, it is absolutely something that women deal with as well. Premature ejaculation will definitely take a toll on your mental health, especially if you just don't feel like it's something that you can control. And so that would fall under orgasm disorders. But delayed orgasm, or anorgasmia, which is also quite common, is the persistent or reoccurrent difficulty, delay in, or absence of attaining orgasm after sufficient sexual stimulation. So sometimes people are doing the work, and they're not getting to the plateau of that process to be able to experience orgasm. And that could result in pain. It could result in, raw skin and, other issues that, could have an effect on your mental health and on the physical body. Although there are many psychological factors such as depression, poor body image, and performance anxiety that have been explored as explanations of PE, none have been validated with control research. Pain during sexual activity, stress, fatigue, hormonal changes, and reduced libido can all lead to delayed or absent orgasm. So think about something. This is something that you could experience even if nothing's technically wrong with you. So say your grandpa passes away. Okay, your grandpa passes away, and you and your partner is like, hey, let's have a little sex. You can experience delayed or anorgasmia because your body and your mind are not linked in the same place, right? You're experiencing grief, other things may be happening. And so even though you agree to this activity and, you normally would be okay with that, in this instance, because of other things, other stress or, whatever, that could cause you to never be able to reach that plateau, never be able to get to that next step. So, and that is, again, I know that's not something that we talk about. We talk about premature ejaculation a lot, but we don't talk about delayed orgasm or anorgasmia just as much. And people do experience that. That's something that even a healthy person is going to experience at some point in their lives. And then lastly is going to be pain disorders. Pain may be caused by Peyronie's disease, which is physical damage to the penis, infections like UTI, prostatitis, which is an enlarged prostate, yeast infections, genital herpes, and certain skin conditions. So if you are experiencing pain, if you have lesions, or if you're experiencing pain during erections, which may mean that the tissue inside of the penis may be damaged, and you may have like calcium buildup, which could cause like a curve, but that curve is painful because of the way the blood moves through the body. So pain disorders are, that I think that would be a common, people would understand why you would not be interested in sexual activity if it came with a side of pain. Nobody wants that. But there are reasons why you may be experiencing that pain, and sometimes we just get the pain and we turn our brains off like, okay, well, I'm just no longer going to engage in sexual activity. Maybe it'll go away, whatever. That's not what we want, okay? Each of these disorders, have multiple treatment options, multiple types of treatment options, okay? So you do not have to survive. You do not have to just turn it off or, let your libido die out. You don't have to do that. There are different treatment options for whichever one of these categories you fall in, but it will take you having to address your physician, getting to your primary care physician and being like, hey, this is what's happening. It's important to me to get it fixed, because your doctor is not going to know that this is something that's important to you if you do not bring that up. So talk to your doctor about it. Let them know what's going on. So what are our options, right? Erection difficulties, rapid ejaculation, delayed ejaculation, and low desire are all treatable issues. The first line of treatment for premature ejaculation includes daily selective serotonin reuptake inhibitors, topic penile anesthetics, and other medications. Okay, so when you first go in, if you're having issues, one of the first things they're going to do is see if if they can fix it with medication or with medical treatment. Sometimes it's changing the medicine that you're on for something else. I've heard metformin has a paramount amount of data showing that erectile dysfunction is a common side effect of that specific medicine. Okay, and I'm saying metformin. I don't know if that's the name or if that's the brand name. I'm definitely not trying to knock no brands. I don't know what the bloop name is, but I have, in all of my years of doing this, I have talked to a number of people who are on that specific medication who do experience erectile dysfunction. So if you are on it, or if you are on certain types of medications and you think that that may be the issue, talk to your doctor about it, because there are other treatment options available. A common cause of premature ejaculation is a hormone imbalance. Both men and women can benefit from hormone therapy to help restore proper sexual function. Okay, so don't think that having to get hormones or being in a hormone therapy program means that, something's wrong with you, or you are, less than. Literally everyone is going to need hormones at some point in time. You're going to have some, and then you're not going to have access to the amount that you had before. So it's going to be a part of your life. Don't get in your mind that, it's something extra that you must do, that it's just going to be one of the things you are going to need to be aware of. Therapy. Both psychotherapy and sex therapy can help with psychological causes of sexual dysfunction. Counselors can help you work through fear, stress, anxiety, past trauma, body image issues, and other issues that can keep people from a fulfilling sex life. So some of the times the blocks that you have, you may not even realize where that's coming from. It could be something that happened to you when you were smaller. It could be an issue that you never even thought was trauma. It can be a whole bunch of things, and you don't realize the correlation between your brain and your body, because the orgasm that you are seeking actually happens in your mind, and the ejaculation is your body's response to that orgasm. So it's actually two separate entities, which we can go on that on another show. But if your mind is blocked, it's not going to let you reach to that orgasm to trigger the ejaculation. So, and that's not all the time. Sometimes when you are, distant, or you are detached from it, you can still experience that. But there may be cases where you're going to have to like lock in and talk to someone about what's going on so that you can get past those blocks. And if you've ever done a session with me, I'm baby therapy, okay? You need to go to therapy. I work best in a triad with me, you, and your therapist, okay? Because your therapist is going to help you clear the blocks in your mind about the way that your body has been taught to behave. And then I'm going to show you how to safely move your body going forward. So, they're going to talk to you about the building blocks of who you are. They're going to talk to you about your childhood. They're going to talk to you about the people in your family. They're going to talk to you about your religious upbringing, all those types of things to help you deconstruct the blocks in your mind to help your body get on board. So, therapy is an important part of your life. We all need it. Every single person on this planet needs to talk to somebody, because you were not raised perfectly. I don't care how much money you have. I don't care how much love. I don't care if you grew up in a 16-parent household. I don't care. There is some point, statistically, the DMS-5 says that everyone will experience some sort of trauma, okay? Even the richest, the poorest, the most loved, the most hated, we all will experience some form of neglect or trauma or something. And so those things build who we are, and they build how we see ourselves and the people around us, and therapy can help you unpack that. So, big proponent of therapy here. Please go. Even if you don't have any sexual issues, please go, okay? And then lastly, we're going to talk about mechanical aids. Men who have difficulty getting or maintaining an erection may have success with special vacuums, devices, or penis pumps. Penile implants are an option for some men, especially those who have lost sensation due to spinal injury. Okay, so I actually have a relationship. I haven't talked about these people in so long. I don't even know what it's called. I don't even know what it's called, but I do have a relationship with a company in the UK that sent me a pump that they had, and I'll have to just put it later on in the chat because I do not remember the name of it. But they sent me a pump to have to say, give this to someone, see if it works. And I gave it to one of my clients, and they absolutely adored it and told a million other people to buy it. But mechanical aids are kind of frowned upon, but at the end of the day, the mechanics of what they do is exactly what you need, right? So you're trying to get blood into that corpus cavernosum, into the cracks to get into there. And sometimes a mechanical aid, a pump, is what you need to coax the blood down there, okay? And even if you had like I said, a spinal injury, you can get an implant that you can use. I seen a video just the other day of a man who said he received an implant. It gives him, the tube goes in, he can pump it up. There is his scrotum, and he has like a third pump in there. And so he has 2 balls and a third pump, and he can pump that thing up, and it brings the penis up and brings the blood into that penis. And then he can release it and let the pump back down, right? And there's nothing wrong with having to use that. You still get the sensations, you still get the feelings, it still feels good. It just requires additional work to do that. And there's absolutely nothing wrong with that as an option, okay? At the end of the day, whatever the issue is, there are multiple ways to treat it. So you don't have to sit in silence. You don't have to suffer in silence. If you want it to be fixed, you can take it to your physician, and they will, let me see if I can find the name, because I'm like, I remember the dude's name because I ended up having a meeting with them. And in the UK, that's it. It was Bathmates. Let me see. The Hydromax pump. That's what it was. And so let me put, you know what? I'm going to put the link Let me put the link. Okay, okay. So, cause hey, I want you to be better. Um, I want you to be able to, hey, I'm here to be a help to you. Okay. What's this? What's this? Oh, I can't get into that either. Ooh, I hope they still open. This has been a while. I talked to them back in 2023. Um, but I can still give you the website. Okay. And like I do have a relationship with them, but I'm not you that's not I don't get paid for nothing. I don't care how much you talking. If it don't work, I don't want to hear it. So this actually is like I submitted it to one of my clients, and they were very much surprised by how it worked, and they were able to see some results. And hey, that's what I'm here for. When I met with them, they said that this is, it's not the U.S., but it is what we would call FDA approved in the UK. So this is considered an actual medical device used for these types of issues in the UK. So again, this is not me, but they said it worked, and they sent it to me, and I sent it to my client, and him and his wife both loved it. So if you are experiencing issues and you do want to try some different types of devices, I would recommend this one. Just because I know someone that I trusted, one of my clients, told me that it helped them, and they've been recommending it all over the place. So, and I don't think I get paid off of like that link or whatever. So do whatever you will with it. But again, my goal is for you to be healthy, whatever that looks like, right? And sometimes it's a process. You're not just talking about something that happens overnight. Like, to find what the issue is could be you going on a rabbit hunt, right? You could start out thinking that maybe it's your libido, and you're saying, hey, I'm just not having the desire. And then you go to the doctor, and they give you some medicine for that, and then come to find out it's because of your blood pressure medication that you are struggling. So it's going to be you making this an important part, making this conversation important. Hey, I'm not experiencing the sexual satisfaction that I would like, and we need to do something about that. So don't feel bad about having to talk to your physician about it, about, the conversation that needs to take place. Hey, again, the goal is for you to be helped. And whatever that takes, whatever that means, is what we gonna do, right? We gonna fix it. We gonna figure it out, and we gonna fix it. So don't give up. If you need help talking to your physician, hop in my inbox. I'll be happy to give you some verbiage or whatever you need to do to, help you to tell them exactly what it is that you need, because you deserve to be helped, and you deserve to have a functioning and fulfilling sex life. Okay? All right. So let me upload the schedule for this week so I can tell you what we're doing. I'm pretty sure I downloaded it. Why don't I see it though? I don't think it's in here. Maybe. No. Something, I don't know, whatever the newest Apple update was, but of course it doesn't let me save to my to external devices. That really pisses me off, because now I gotta go like move it. I wish I had turned off the automatic updates. I got it turned off on my phone. I need to turn it off on my computer, because that really made me mad. Now I like every time I try to save it, tell me can I move file. Done pissing me off. Sorry. Well, them 10 just be right there, don't they? Okay, anyway. Today we're talking about male sexual dysfunction. Tomorrow, 12:30 p.m. Central Standard Time, we're going to be discussing it's Pleasure Tools Tuesday, which is external tools that you can use to spice up the bedroom. We're going to be talking about impact play and spanking the safe way. Okay, most people, spanking is a very common kink, so most people have been introduced to it already, but let's talk about how we can incorporate it safely and how we can expand on the knowledge of impact play. Okay, Wednesday is going to be Ask Coach Catasha. So if you are free, 2 p.m. Central Standard Time, stop by. I will be answering your sexual health questions live. You can come in, drop them in the chat. I will be happy to give you an unbiased answer. If you are kind of shy and you don't want people in your business, which I completely understand, please feel free to send that question to expressionoverrepression@gmail.com in advance. I can bring it back to the chat on Wednesday and I will submit that question, without your username or handle or anything to it, so people won't be in your business. Okay, and I'm fine with telling your business on your behalf. Okay, I'm just fine with that. So stop in. We're gonna see if TikTok let us back. Yay, hey. We'll see if they let us back. But I'm sure we'll be there. But feel free to stop in, ask your sexual health questions, ask me anything. It could be have to do with gender, body image, whatever. I'm here to be of service to you. Okay. And then on Thursdays, it's going to be Sex Tech Thursdays, where we're going to be talking about the advancements between sex and technology. And we're going to be talking about neurodivergent sexualities and how we are just now building plans and aligning sexuality for people with spicy brains. Okay. Especially when we're talking about consent and, gender and things like that. Sometimes spicy brains move a little bit differently, so we're going to be looking at what that looks like and what are some things that are being incorporated to make sure this safe is space for everyone and that it is accessible for everyone. So that's going to be Thursday at 12:30 p.m. Central Standard Time. And then on Friday is Late Night with Coach Catasha. We will be here at 9 o'clock. I swear, every single Friday, I am completely blindsided by the alarm. It tells me that it's time to record. Every single Friday. I've been doing this since February. I've been on every Friday since February, and I swear, every Friday, I'm like, oh, I'm supposed to be recording in an hour. But come in, hang out with me. This is a check-in for y'all. So just kind of seeing where you are, what's good for the week, what do you have going on. How are you feeling? Stuff like that. Just a way for me to keep in contact with you and keep in touch and make sure that you are good. Okay, so that'll be Friday at 9 p.m. Central Standard Time. You can find these streams on YouTube, Twitch, and Facebook, and sometimes TikTok. And to find me, you can just put Coach Catasha in any of the search bars and I will pop up. Okay, so that is going to be our stream for the day. Let me make sure we don't have any questions or that I didn't miss nothing. I don't think I did. Yeah, I don't think I did. I think that we're good. Yeah. Okay. And you know what? I think I'm going to reach back out to them because my mom had passed like right when we started and they wanted to meet and stuff, and like I was not here, so I never like got back in touch with them or anything like that. But I really do want to work with them again because I believe in their product, and I mean they sold me on it. I was like, yeah, and this is how it was invented, this is what it did. I'm like, ooh, I love me some good science and stuff together. So we will be back here tomorrow at 12:30 p.m. Central Standard Time to talk about impact play and safe ways to participate in impact play. And so I hope to see you here. ready, bright-eyed and bushy-tailed. I'm going to show a little bit. We'll use some impact toys. I'll bring some stuff on so you can look at different types of impact toys that are used. Well, what I hope I can show some. You never know. Also, we got a couple more days. Let me get my couple more days of until October 1st. You can join our Patreon, and for $3 a month right now, if you join, you will automatically be grandfathered into our the next tier up. So our tier right now, the $3 tier for a month, is just going to be for support only. And then I've uploaded some a role play on there. I'll be uploading another one today, another video today for you to check out. I think we're going to do a BDSM video today. So lock in. You can sign up for $3 a month and until October 1st, and help support sex education for everyone, for the practical people, right? For us who need a little bit of help breaking down the details. So I appreciate everyone who's already signed up. I appreciate all of the viewers who tune in, who have hold on, I can't think and do this at the same time. Okay, there we go. I appreciate all the people who have committed to whatever platform you've subscribed, people who are watching and who send me questions. I appreciate all of you for, helping this along. Your questions help me to answer questions for other people who may be a little shy or don't know how to ask for help. So I appreciate all of you. I will see you back here tomorrow, 12:30 p.m. Okay, Central Standard Time, for Pleasure Tools Tuesday. Okay.